So poor flow trigger, as you all know, we just explained that for a flow trigger to properly work, we set a threshold, and usually we set a 3 liter per minute difference between inspiratory limb and expiratory limb. And once the ventilator senses that the flow that here is bigger than the flow here by 3 liters per minute, for example, this is the threshold, just an example, it will go and deliver the breath. So the first thing, if the patient inspiratory effort is very weak, that means he's triggering, trying to initiate a breath, but his inspiratory effort and muscles are really weak. The patient may be able to, if it's 10 here, pull 2 instead of 3, and here will be 8, or 2.5 or 1. So the ventilator, the patient trying to breathe, you look at him, the patient moving his inspiratory muscles. You look at the patient, but there is no breath delivered by the ventilator. So you can tell that the patient, this is a poor trigger. So this is the first scenario, and simply you can solve it by lowering this threshold from 3, for example, to 2. Then that will solve the problem. So you're looking at the patient, he is trying to breathe, he's moving his inspiratory muscle, but no breath delivered by the ventilator. So you lower the threshold, and that hopefully will solve the problem. That's one thing. So how do you identify it? Or before how do you identify it, another scenario I want to make you aware of is nebulizer treatments. Nebulizer treatments is basically a tube, and will be connected here, and you give an extra flow, for example 7 liter per minute. So you have 7 plus 10, now this will be 17, right? The problem here is that the patient now has to pull this amount plus the extra amount here, 7 for example. So instead of the patient will be needing to pull 3 liters, now has to pull 10 liters, and that can happen when you give a continuous nebulizer treatments through the ventilator circuit. So that's another problem, because I have to make you aware that the ventilator will sense there is 17 here, and has to sense that there is 7 or 8 here. So we add this problem. How to fix these possible scenarios? The first scenario, where the patient is moving his inspiratory muscle, but only receiving backup rate, because the ventilator not sensing any breath coming from the patient. Simply lower the trigger from 3, for example, to 2. The solution for the second problem here, where we use a continuous nebulizer treatment, is simply switch to pressure trigger, which I will talk about next video. So how do we identify it? Again, the patient trying to initiate his breath, he's moving his inspiratory muscle, but only receiving backup rate. You may see in the monitor that the patient respiratory rate is high, but only receiving backup rate from the ventilator, and this is how to fix this issue.